purposes. Before that, it was being used for the treatment of venous ulcers only. So it was found that it's a miracle gas, the carbon dioxide gas, which was actually treating the panda eyes, means those blackening under the blacks, the dark spots, darkness under eye circles, the dark circles, and the jowls. Jowls are these sagging parts on in the face. With the gravity and with aging, the muscles, they just slide over this the periosteum, and then the fat which is there, which is giving the protuberances over the face, the zygomatic protuberance, and the buccalis muscle, which is having a good buccal fat, they all just gravitate downwards, and they make you can say the cellulite and lumpiness, small lumpy granules of fat. They just sag down, and they just make their position in the sagging skin, and that is the way uh, cellulite is formed. And in face, it is known as jowls. So they give the aging appearances, and they all are being treated by this carbon dioxide gas. They were being treated with this carbon dioxide, and first of all, they were being utilized in Brazil. And then again, the 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 swelling just below the eyes. So eye bags are something which are uh, which give the anxious look and the aging look, and even males, they come for the treatment of those eye bags, and there is no treatment. See, the hollowness can be treated with the help of fillers. So fillers are to fill the gap, but the bags swollen up cannot be treated by anything else. So this is the best treatment for this eye bags and those jowls, cellulite, I told you. So they do lipolysis also, and they do the wrinkles are also removed. So they give the fair and the even skin tone and other things. It has been found that this carbon dioxide gas does that kind of miracle. So the definition is the therapeutic administration of small quantities of medical grade gaseous CO2 with controlled flow into the subcutaneous tissues through a needle. You can see here in the picture, the needle is just delivering the CO2 gas. And the gas is injected either into the subcutaneous layers to improve fat, either into the dermis layer to improve wrinkles, stretch marks, and under eye circles. So the deposition, where you have to deposit, so that depends upon the angle of inclination of the gas deposition and how much depth of the needle is to be introduced into the skin. And this is my machine, which I am having. Somehow, the Skymedics people are now not delivering these machines in India, but I was lucky enough. I got the last, or I think one, two, three before the last. I got this machine, and this is a wonderful one. And the whole machine is having the lower part, which is a long container only. This is having the CO2 cylinder. Though it seems that it is a long laser like machine, but the lower part is a container which is having the CO2 inside, the CO2 cylinder, the black cylinder. And the upper one is the digital part, which is actually automatically, which heats up the gas, as well as there are two ports, A and B, you can see. There are two tubings also, A tube and B tube. And terminally, there is a needle, which is 31 or 32 gauge needle, with which the gas is delivered. So two tubings are there. So you and your assistant, they both can handle the two parts in the body. So the device delivering the warm medical grade CO2 gas has a gray cylinder, as I told. The terminal part is 30 gauge or 32 gauge mesotherapy needle, which may be 4, 12, or 13 millimeter long. Because inside the vagina, if we want to deliver this gas for vulvovaginal rejuvenation inside the vagina, we need the longer needle. Or I just put the spinal needle also in this, and I can just deliver the gas. A foot pedal controls the gas installation, or there is the automatic button also. So you don't need to press the foot pedal. The output pressure of the medical grade CO2 from the cylinder is needed to be equal to or higher than 40 kgf per centimeter squares, kilogram force per square meter centimeter. For the device to work, gas flow is in milliliter per minute, and the parameters are selected and set individually depending on the site and the indication. Though it seems to be complicated, but it is the easiest thing. And this has given me the results equivalent to PRP treatment separately, and sometimes equal to Botox, and somewhere it does lipolysis also, just like cryolipolysis. So the history tells that the anti-infective properties of carbon dioxide were described by Boyle in the 17th century and by Lavoisier in the 18th century. Lowlett in 1777 proposed a serial application of CO2 for treatment of chronic skin ulcers in the lower limbs. And how they got to know? It was found Lowett in 1777 showed that carbon dioxide improved chronic and inveterate skin problems, especially in foot ulcers, not responding to convention treatments such as daily dressings and debridement. Carbon plethora, those springs which were having plethora of CO2, where the people with ulcers, they were taking baths, they were bathing in those swimming pools or in those springs, and it was found that they got better with the serial bathings. And they got something clicked in their mind that this CO2 is doing something, and they started giving it therapeutically. And then it was found that yes, this CO2 is a miracle gas. And transdermal CO2 application in chronic wounds. The papers have also been presented for this. And you can see the diabetic ulcers, they were with the serial applications of CO2, they were healed. Some uh, histological pictures are also there, which show that neoangiogenesis is there, neocollagenosis is there, the whole skin, the whole dermis as well as epidermis, they all are modulated, modified, and the results are better. How you inject this gas? So that depends. If you want to do lipolysis, if you want to degrade the fat, then you have to enter into the skin vertically. So between 45 to 90 degrees. And if you want to work on the wrinkles, or if you want to work on for the skin rejuvenation to be superficial, or in the vagina for the epithelial regeneration, then you have to be superficial, and your angle of inclination should be between 15 to 30 degrees. So this is a very important fact. For superficial installation for wrinkles and problems of skin and mucosa, the angle between, as I told. For deeper intradermal injections is between 45 to 90 degrees, 2 to 2.5 millimeter of the needle deep. And for superficial, you have to be just bevel deep. So the tissue. So everyone asks, how would we know that enough gas has taken its place in the skin? So the end point is attained by the inflated, distended tissue and erythema. And the patient tells, once the inflation of the gas is there, the patients are okay. But overinflation, or at the end point, they will start wincing that they are having some kind of pain. That shows that the tissue is now getting over distended, and then you have to stop. Otherwise, the machine is also automatically such in is automated in a way that a definite amount of gas flows with 25 ml per minute, then 50 ml, then it exceeds to 75, then 150 ml, and then the flow is cut off. So that if you forget, or if you start doing inflation, that doesn't mean that the gas is going to involve everything and the patient is going to be, uh, the total inflation is there. No, the gas is automatically cut off, and then you have to switch on the machine again. So it goes to the pause mode. The effect needs multiple sessions to be apparently visible, and the number of sessions needed depends upon the expertise of the clinician and the condition of the local area to be treated. So I have got a very good result for the dark circles, under eye
देखो मैडम,
circles.
I am a good student.
Yeah. So I can see, sir, you are present here and you are listening to
Not
everything.
me.
And please correct me if
Not me.
I
It's
am
someone.
wrong
It's
somewhere.
someone else who spoke. It's not me. It's someone else who spoke.
No, no, no. I know. But who is this then? So let me know who was there.
I think it was Amir. I think it was Amir.
Oh,
Anyway,
oh, Dr. Amir. Yes. सर आप मुझे बता दीजिएगा if something is like, if you feel something is
perfect चालू है.
wrongly being delivered.
नहीं नहीं perfect चालू है.
Okay. Thank you, sir. So, and the best results I have got with the stretch marks, because it is very difficult to treat stretch marks. A large tummy, the patient delivered the baby, and those who are obese, they have got, the heavy built, and they come to you with large surface area over their tummy with multiple stretch marks, deep stretch marks, and they ask something. And stretch marks are the most difficult one to treat in aesthetic gynecology. So there you treat these stretch marks with carboxytherapy if you treat with. Otherwise, you are doing micro needling and PRP application. That also works fantastically. But 100% results are never attained with any kind of treatment. So if you are getting the equivalent treatment with CO2 insufflation, then it is going to be the cheaper substitute for anything. And a bit better results are also attained. This is my experience. So here is my video, which I am showing how the gas is flowing and how I'm going to treat the. So is it audible?
No madam.
Somebody please.
No, ma'am, it's not
No,
audible.
ma'am, it's not
No,
audible.
ma'am.
Oh. Then
Ma'am,
I
the
would
video
detail.
is
We
visual, I
can
think
please
so.
see the video.
Okay. So see, from in the video, I just did some manual work on the for automatic flow. And now the needle is at 15 degrees. I am just insufflating the skin. And you can see the stretch marks are what? They are just the torn areas. The collagen actually is torn apart in those areas, and those stretch marks appear. So you are just putting this gas. See, the gas is flowing inside, and it is just the far stretch marks are also being insufflated. And once the redness appears, that shows that now that area is to be is completed, and you have to choose another area, another entry point. And this carboxytherapy is very good for the hypertrophied scars also. So those cesarean scars and under the scar, you have to insufflate the carbon dioxide gas. So see here again in these stretch marks, and at every weekly interval, I repeat my therapy. And after 8 to 10 sessions, the beautiful skin with very thin stretch marks. Stretch marks never disappear. The skin tone actually is becomes better, and the skin which was torn apart, the those collagen materials and the coiling recoiling occurs, and those stretch marks become hairline structures. So I hope I'm able to make you all understand that yes, this is the way the stretch marks appear, and with the help of this carboxytherapy, the it becomes nearer and nearer, and lately only a hairline structure remains at the place of this stretch mark. Okay, so this is the way I will cover the whole area. And in the meantime, after 5, 6 prickings, you have to change the needle also, because then it becomes painful. Multiple prickings, so the needle becomes blunt. And if the larger area is to be covered, you have to change the needle in between. Otherwise, this is simple application. You all are the renowned gynecologists, and you all are doing laparoscopic surgeries. You are filling, insufflating the CO2 gas inside the abdomen, and you are doing fantastic laparoscopic surgeries. So you don't have to think about this insufflation even a single time. You just have to start doing this, and you can get the fantastic results. So you can do the same insufflation in the double chin area, or the areas where love handles, or the tummy, the sagging tummy, or the areas which is having the fat, and you want some body contouring. Because with exercises, you can just reduce the body fat throughout from all over the body. And first of all, the face actually is the part which shows the fat loss, and the cheeks become sunken, the eyes become sunken, and it is visible that you are doing something. But the body contouring from a specific point of the body, you are not able, like Mons plasty. If you want to do some Mons plasty, Mons is having pad of fat, proper fatty Mons you are having. After a few deliveries, the ladies are coming for Mons plasty, and there you can utilize this carboxytherapy. Go straight 90-degree deep and give this carbon dioxide 6 or 8 sittings, and you would be seeing the visible effect. So before starting the procedure, a written consent is must. Bladder should be asked to be emptied. As before any gynecological procedures, a numbing cream is to be applied 30 to 45 minutes prior to the procedure. Contraindications are to be ruled out, and side effects should be well explained beforehand. Tetanus toxoid coverage should be confirmed. Essential and relative blood investigations should have been done, especially blood counts, viral markers, and coagulation profile. Proper sterilization should be maintained. Patient should be kept under observation for 15 to 30 minutes after the procedure. So, what are the characteristics? Why we use this carbon dioxide gas? Because this is a colorless, odorless, and soluble in water, heavier than air, final product of organic metabolism. So, it is autogenic. So, it is not going to cause any kind of reaction in the body. Non allergenic, non toxic, non embolic, even. It is a blood soluble gas, and its solubility in tissue is more than 25x than oxygen. So, if insufflation is there, under eye insufflation actually makes a patient panicked. She always or he always asks, "ये क्या हो गया? मेरी eyes इतनी मोटी मोटी, and I'm going to walk on the road, and how will I enter in my house?" And then we tell that just sit here for 20 to 30 minutes, and everything is gone, and everything becomes normal. So the effects, how we attain the effects, physiological effects, and they are of two types: the direct action and the indirect action. So, direct action, where the point, the targeted tissue where you are insufflating the CO2 gas, and indirect action, the far off organs also, and the areas, the blood and the tissues, they also get activated with the help of this carbon dioxide gas. So active arterial vasodilatation is there by direct action of CO2 on the vascular myocytes locally, and by indirect action on sympathetic system causing vasodilatation remotely. So it increases the blood flow, and it induces vascular endothelial growth factor also, VEGF. And that way it causes angiogenesis too. So it increases the microcirculation. So neoangiogenesis is attained, and neocollagenosis too, lipolysis, and CO2 insufflation causes increase in pH level. Stimulation of subcutaneous baroreceptors is also there. And the final effect is because of Bohr effect. So histopathology is also there, the beautiful skin and the epithelium as well. So receptors, the Golgi's capsules and the Pacini's capsules, the other, all those receptors are activated, and Bohr effect. So Bohr effect is there, with the help of which we are exhaling carbon dioxide and we
बोला
are
है ना हाँ
inhaling
इंग्लिश
oxygen.
मध्ये झालं येते थोडं झालं
And this the same effect is there, which clearly tells that the areas where CO2 is more. Otherwise, the gas equilibrium law says that in a closed space, if one gas is increased, the other gas decreases in the amount. This is a simple phenomenon. But with Bohr effect, what happens? The areas which are rich in carbon dioxide, those areas, their hemoglobin deloads its oxygen more. So the areas where you are insufflating the areas with CO2, the oxygen itself is getting delivered to those areas. And that oxygen is doing the job. So the simple Bohr effect we are getting, the pH is decreased, and with the formation of hydrocarbonic acid, and which actually asks the hemoglobin to deload its oxygen to the area where the CO2 is more. So, and another thing, what it does is it gives a bit of physiotherapy too. So it has got a spasmolytic effect and analgesic effect also. And that is with excess of carbon dioxide gas, the reduction of divalent ions and the split of carbonic acid to H plus and HCO3 minus occurs, which leads to the formation of calcium hydrogen carbonate, sodium hydrogen carbonate, and potassium hydrogen carbonate in the areas, targeted areas. And now the pH becomes alkaline. And it becomes the reason for its analgesic and spasmolytic effects. The arterial and capillary tonus is decreased, and the skin temperature is increased by 1 degree centigrade. There is the changed activity at the nerve endings also. All these effects combinedly improve the trophicity of the treated area. That area becomes supple, and that area becomes even with very good tone. So carboxytherapy in genital rejuvenation. So this was the whole physiology as well as the properties of the carbon dioxide and how its physiological effect is attained. Now, the whole knowledge of this, see, I always tell that cosmetic gynecology is the knowledge of cosmetology being applied into the gynecology. So once you are very well aware of the whole the effect of carbon dioxide aesthetically, now you are going to use that aesthetic knowledge into the gynecology, and you are going to apply this carbon dioxide therapy for genital rejuvenation. And that the effect is again trophic, functional, as well as sexual too. So it enhances functionality, turgidity, hydration, and sensitivity of the genital area. So main indications all over the body are eye bags, stretch marks, cellulite, alopecia, fibrosis, scars, wounds, ulcers, and also for intimate rejuvenation, which is our topic of interest. So in cosmetic gynae, we can use it for episiotomy scars, post-cesarean scars, fissures healing, decreased lubrication in GSM patients, decreased sensitivity, skin laxity and sagging, and muscular laxity too. Contraindications are many and are those which all are contraindications for any kind of carbon dioxide retention in the body. So, artificial pacemakers, acute MI, history of CVA, history of TIA, unstable angina, acute thromboembolism, congestive cardiac failure, coagulation disorders, under anticoagulant treatment. A congestive cardiac failure patient, why she would move here from here to there for aesthetic treatment, I don't understand. But yes, we have to mention everything. Just a minute. Can I take this call? Just a minute. So I'm sorry, it was an emergency in the hospital, and you would be surprised to know the injury was because of that manja, that patang ka manja, Somebody was moving on the motorcycle, and he was our lab boy, so I had to take that call. And the whole neck is now deep cut is there. Oh my God, these things. So just a bit. अरे इसमें स्टिच लगा दो, है ना, सबक्यूट और उसके बाद ऊपर, ठीक है. And other contraindications for vulvovaginal treatment is if the lady is pregnant, उसमें स्टिच लगा दो, उसमें सब क्यूब भी लगाओ और ऊपर लगाओ, है ना. थोड़ा थोड़ा सा नीचे का टिश्यू लेके पहले पास करो और उसके बाद ऊपर ऊपर वो लगाओ, मैट्रेस लगाओ, ठीक है. आई एम सॉरी. So pregnancy, lactation, these are to be avoided in every case. Deep vein thrombosis, infection at the application site. But I have got very good results in infected parts also, because we were talking about the ulcers. And current genitourinary disease, if the patient is suffering, you should avoid, and the patient should come back after the treatment, like vulvovaginitis and other things. Then see, this I am especially mentioning here because what happens sometimes there is contamination of oxygen in these cases. So once I did for the eye bags in a female, and there was swelling. The whole, both the under eyes were absolutely inflated, and she started screaming, "What happened to me? How would I go?" So I just made her see the other patient's pictures, and she was actually asked to sit there for 30 minutes, but she was not able. The whole swelling didn't go away, it didn't disappear. And I was also surprised, and then I got to know that if the oxygen contamination is there, and sometimes it happens in the cylinder, there is some oxygen over there. So your tubings should be emptied. The initial part of the gas should be emptied out, and then proper CO2 should be insufflated. She got rid of that swelling after 48 hours. And she was a patient, she was just abusing me, cursing me. And after once the swelling was gone, then she came to me and just asked that, "Ma'am, I was actually very skeptical and I was very worried, and that is why I did. But yes, everything is gone. But you should also tell me that, yes, this may take 2 days." So I just wanted to point out these things also. So these are the results, and they are very much comparable to PRP therapy. And if you are combining your PRP therapy with carboxy, the doubled up effects are attained. So this is for females also. And for stretch marks, for hanging arms, many patients come for such sagging arms, the treatment. And this cellulite, this is not my patient. This picture I got from the company persons. And the scars, yes, good results are there. But yes, 100% corrections are not there, but better results are there. And stretch marks, as I told, the tone of the skin actually becomes better. And that is why the stretch marks are treated. Eye bags, I told you, very good results in eye bags. And ulcers, wounds, non-healing ulcers, those trophic ulcers, they all actually are treated with the help of they are very difficult to treat. And if you are if you are adding up this treatment with your regular treatment, any kind of treatment, especially the sexual satisfaction in a female with GSM, or in a female with other kinds of, the aesthetic problems inside the vagina. So there should be some indices or some kind of mapping should be done to get to grade your treatment and what kind of results you are getting. So best is female sexual function index, and I have used this and I have got better results. The patients were happy and they gave good reviews also. Some side effects, very few. So minor local side effects are there. There are no reports of adverse effects or complications, both local and systemic. Moderate pain on the application site during treatment just because of the pricking of that needle. And that too, if you are applying Prilox, the pain is minimal. Small bruises caused by puncturing with 30G needles. So some minor blood vessels, they just cause bruising. Feeling of small subcutaneous emphysema at the application site, which disappears after a few hours, not after 1 hour, even in 30 minutes only. So presentations are there. So people are working with it. And it is a good alternative method in removal of various skin defects. Stria dehiscens, best results with CO2 therapy. And it is very good for the cellulite treatment also. So the conclusion is an innovative clinical treatment in vulva, vagina, and perineal area with an outstanding performance. And it's a daycare procedure. So often it offers women a quick, painless office treatment through a non-invasive method for improving vaginal health, sensation, sexual satisfaction, and resuming better quality of life without the need to keep the patient for recovery. And there is no downtime at all. This is the best thing. So thank you very much. And this is the carbon dioxide gas, which actually took us to a special height. And this gives you that let's fly in the aesthetic sky with the help of this carbon dioxide gas. Thank you very much.
Thank you, madam. That was really an enlightening talk. I mean, fantastic. Never knew that CO2, apart from laparoscopic insufflation, has so many uses. So there are, I think there are huge number of questions. Yeah,
Oh,
Naval and Kaushik.
yeah,
I'll take it. Ma'am,
Yeah,
can you please stop sharing your slides?
yeah, sure.
Yeah.
Let me know how to do that.
Ma'am, before you stop
Stop
sharing,
share. Yeah.
yeah,
Yes.
right.
Mhm.
So there are a few questions in the chat box. Some of them
Mhm.
delve into dermatology and surgery, but then anyway, uh, ma'am, any role in keloids regarding this carboxytherapy?
See, in keloid, the effect could be ironical. I'm not sure about that. And I have not even tried because before that, we take the consent. And if I have always, a few patients came to me, a very good friend of mine came with her daughter that please do this. And when I put that consent form in front of her, and I told that maybe the keloid may actually regrow, or maybe the hyper growth of these kind of then they were scared, and so I am not able to tell any kind of effect with with this carbon dioxide therapy in keloids, and I couldn't find in journals and other places also. So hypertrophied scars, I have done it, but not in keloids. I'm sorry.
Right. Thank you. So,
Mhm.
ma'am, skin tone after 8 sessions, and how much gas is to be instilled per session?
See, I told you that the end point is, see, few patients come with a very good skin. I remember I attended a lecture in some Foxy conference in UPCon or somewhere, where it was a wonderful lecture on the skin tone and the effect of that collagenesis on normal deliveries. So those patients which are having very good elasticity of the skin, they were delivering babies normally very easily. So that always clicks in my mind, and I find that those patients which are having lesser stretch marks are having good quality of collagen in them, and there the results are better. But few patients come with sagging tummy and multiple stretch marks, numerous, like uh, uh, they need multiple sessions, and results are also not that up to the mark. But yes, I can say that yes, the skin tone becomes better because of the neocollagenosis.
Right, ma'am.
Some
So, one more very, very, very important question. What is the cost of the machine?
See, what I purchased, I would definitely tell that is a 12 lakh machine, and 12 to 14 lakhs, maybe he was kind enough to give me in a subsidized rate. But these days, that machine is not available. But yes, few are in the market, and I would suggest that go for a better one, not for the cheaper ones, because it is not that expensive as other energy based devices. So try to work a bit and go for it. Or you can ask me. I would be searching for newer vendors, and I would be telling.
Right. So,
Madam,
ma'am,
you mentioned,
continuation.
yeah, yeah, Kaushik, yeah, madam, you
Yeah, yeah,
mentioned about the endpoint of the amount of gas instilled.
Yeah, yeah. I told you that the insufflation, once the endpoint is reached, the patient will start wincing, and you will get a bit of redness in the surrounding areas. The insufflated areas and the peripheral areas will become a bit reddened. So that is the end point. Patient will tell that, yeah, yeah, I'm having pain, and you will come out with your needle. So that is the end point. Nothing, like I told you, nothing is like the excess amount of CO2 is going into the skin, and that is going to cause any kind of problem or any kind of side effect. Nothing. Just the expansion of the skin and a bit of pain because of the stretching of the skin.
So no
Nothing else.
local anesthesia should be used.
I told that Prilox prior to the installation, half an hour or 45 minutes, local topical anesthesia, just to avoid that pricking pain because of the needle is pricking inside the skin, and then the gas is being insufflated, just to avoid that kind of pain.
right. Ma'am, suppose someone does not have this machine, but then they are practicing laparoscopy. So, can they use the same insufflation machine that they use in laparoscopy? Or is it a different machine?
No, because the excess amount of that gas will go, and the whole area would be insufflated. You won't be controlling the gas. The machine is only automatically controls the flow. There is the flow meter. Yes, you can take the consent from the patient that yes, I would be insufflating, or you can try. But see, the CO2 excess amount of gas actually goes with laparoscopic insufflation. So that is why in my presentations, physical presentations also, this question was asked, and I have never tried. Let's do some innovation. Maybe somebody else would come up with some new the technique, and thoda jugaad maybe.
Right. So, ma'am, like in body contouring, there are two questions, but I'm combining into one question. So, like, in case of body contouring and whatever, in fat dissolving thing, uh, insufflation in which layer of the abdominal wall?
we go subcutaneous, just below
Okay.
the dermis, the subcutaneous fat area we are taking care of. And in contouring, we do that lipolysis. So the gas is going over there, the oxygen is being delivered over there, and phagocytosis and everything happens in that area only. As in aesthetic medicine, lipolytic injections are available. And so those injections, uh, uh, we make with topically we make a crisscross structure. We make multiple blocks, and in every 1 centimeter apart, blocks are created, and we are giving the injections, the lipolytic injections, for aesthetic medicine purposes, in for the treatment of, the mm, uh, this double chin and the protruding areas which are to be treated, where the surgeries, the plasties are not to be done, and the patient wants some relief in those areas. There, the same effect, the lipolytic injection type of effect is attained with the CO2 insufflation.
Yeah, ma'am. When to be started in postpartum period? Like how many weeks after the delivery?
See, it has not been quoted anywhere, but we follow that 6 weeks rule in any kind of procedure. And I always suggest that go for 12 weeks. Give her 3 months to or take proper rest, and give the time to body, give the time that body could heal itself uh, with its own growth factors and other, the healing cascade. And then she should report to the aesthetic physician or aesthetic gynecologist.
Madam, typically, how many sessions are required postpartum for this trial?
For trials are 10 to 12 sessions even, and 50 to 60% results are there, not more than that. I should be very clear about that.
Ma'am, and how
Hmm.
far apart are these settings?
Minimum 1 week apart. Minimum.
Right, ma'am. As you said, you tried them on stretch marks after pregnancy. One more question pops up. Does it
Mhm.
help in teenagers who lose weight rapidly and have stretch marks due to obesity?
It is very effective, but see, we always go for the treatment in patients who are more than 18 years, just to avoid, legalities and other things. But see, 18 plus, many girls are coming to us, those with PCOD, they have lost weight, or those who have attained weight also, they are coming for stretch mark. On knees, they are having very bad stretch marks on their knees, on their elbows, and in their arm areas. So they are all coming, and we are treating.
Right,
This
ma'am.
is a good
Any
machine, good revenue
yeah,
generating machine. Yeah.
yeah. So, ma'am,
Yeah.
another question pops up. Although it's not a cosmetic gynecology, which plane and which site to be injected in non-healing answer?
In non-healing ulcers, what we do, we just insufflate the surrounding healthy areas, the peripheral areas around the wound, just like PRP installation. In those non-healing wounds where we treat them with PRP, the same PRP also we just insufflate the surrounding areas. So the healthy tissue delivers more and more growth factors to the surrounding areas, and the healing starts from the peripheral areas, and it just moves into the central part. So centripetally, it is just taken care of.
Yeah, and one more question. How do you rate this carboxytherapy as compared to other aesthetic modalities like lasers and all that?
See, I should not do that because it has got its own indications, its own physiology of how it is taking care of everything. Energy based devices are something which are giving the results with thermal power, thermal energy. And this is another kind of things. It is stimulating the local area to just to deliver more and more of, the it is stimulating the healing cascade in a way as PRP does. So we can compare those two treatments, but we cannot compare it with other energy based devices. Yes, the results are comparable, but sometimes, you need thermal energy itself for the resurfacing. So CO2 therapy is not going to do resurfacing, re-epithelialize. Yes, the epithelium is broken, it is going to help. But the whole epithelium is going to be replaced with the help of CO2 therapy. It is not. So first, one should learn everything. So your program, this whole program is just to make everyone learn each and every aspect of aesthetic gynecology, and then the whole knowledge should be actually intermingled, incorporated, and then you are going to make some cocktail therapy and you are coming up with your own protocols. This is, I think, our motto.
Yeah, ma'am. Is the CO2 that you use for therapy, is it the same CO2 that they use in laparoscopy? The cylinder and all that?
Exactly the same.
Right, right. And okay, ma'am, like you said, the company that sold you the machine, they apparently don't sell you. They are not in India anymore. So what about the warranty of the machine? That is one actually question in the chat box.
Yeah, actually, I am connected to those people, and somehow, sometimes, some few buttons with which we were not familiar initially. So it was very difficult, but I got connected